AI will replace doctors. Such statements have long been a reality, and medical AI is being introduced into practice at an astonishing speed. Especially in the field of diagnostic imaging, it has been expected to be a magic wand capable of instantly detecting even tiny lesions that humans might miss. However, in 2025, a shocking report was published in the prestigious medical journal, The Lancet. It revealed an inconvenient truth that we have been ignoring. It was a warning that AI may not be helping doctors, but rather dulling their inherent skills. The more we rely on AI, the weaker human professionalism becomes. What is happening in the medical field now? And how should we confront AI? This article delves into the true nature of the unknown side effects brought about by technological advancements. The integration of these systems was supposed to be the ultimate safety net, but the net itself is starting to change the way doctors see. This time, the focus is on the introduction of AI in colonoscopy. If polyps can be detected early, the survival rate for colorectal cancer can be dramatically increased. Therefore, an AI-assisted system was introduced to prevent polyps from being overlooked. The initial goal was for AI to act as a second eye for doctors, improving accuracy. However, inexplicable reports began to emerge from the field. Doctors who had continuously used AI-equipped equipment found a disturbing trend. When they performed examinations in an environment without AI, the polyp detection rate was lower than before the introduction. This was unexpected. In technical terms, this is called de-skilling, or skill decline. Why does this happen? It is the erosion of mastery through automation. It has been pointed out that doctors may have unconsciously assumed that there is nothing where the AI doesn't light up, leading to a decline in concentration. This potentially leads to a decline in their long-cultivated skills of concentration and spatial awareness, the ability to observe every corner with their own eyes. As a result of relying too much on AI as training wheels, they lost the ability to ride a bicycle on their own. The fundamental balance is gone. The problem is not just a decline in skills. Excessive dependence on AI is also a serious issue. We are outsourcing our intuition to an algorithm. AI is not omnipotent. It will easily make mistakes in cases not included in its training data or under special conditions that it hasn't encountered. However, it is known that once humans trust AI as correct, they fall into a psychological trap called automation bias, a dangerous mental shortcut. This bias makes them unable to correct the AI's incorrect judgments. They follow the prompt even when their training tells them otherwise. If AI says no abnormalities, doctors will diagnose no abnormalities without much thought. The machine's silence is taken as a definitive clinical truth. Ideally, doctors are in a position to consider the AI's opinion, but ultimately make their own decisions. This is the core of professional responsibility. However, in their busy daily work, blindly accepting AI's judgments tends to become a rational choice to reduce the burden on the brain. It's the path of least resistance. As a result, doctors are reduced from the main players in diagnosis to operators who merely confirm the AI's output. Their expertise is being sidelined. The warning sounded by the Lancet report was not merely a discussion of accuracy, but struck at the very essence of what constitutes human expertise. So, should AI be eliminated from the medical field? The answer is no. We cannot retreat from the technological horizon. The important thing is not to reject AI itself, but to rewrite the implementation blueprint. We need to design the human back into the loop. For example, instead of AI providing the answer from the start, it could be activated as a confirmation tool after a human has already made a judgment. Alternatively, the use of AI could be restricted in the medical training process, and the human eye could be thoroughly trained first, without digital crutches. Furthermore, the introduction of explainable AI, which presents the rationale behind a judgment in a way humans can understand, is essential for trust. Positioning AI not as a magic wand, but as a pair coach for training and improving humans. It should sharpen us, not make us dull. Rather than technology robbing us of our abilities, we need technology that makes us sharper. We need to design a co-evolution system for the future. In 2026, as AI continues to evolve, we are now being forced to re-examine what we are losing as a price for convenience. The side effects shown by medical AI are not limited to the medical profession. It is a warning to all of us modern people living in a digital world. We are losing the ability to remember routes by relying on GPS and the ability to think deeply by relying on search engines for every single thought. AI was not created to make us stupid. It was created so that we can be more human, more creative, more capable than ever before. The wisdom and the resolve to master this ultimate tool are now being tested. We must choose to remain the masters of our own intelligence.